Welcome, everyone, to Tinnitus 101, presented by Northwest Hearing and Tinnitus. We're so excited you're taking this journey to learn and to discover more about tinnitus. Let's get started. Tinnitus is derived from the Latin word tenere. Do you know what tenere translates to into English? Well, if you guessed ringing, you'd be right. Tenere means the ringing or the tinkling of a bell. Now, while Tenier tells us exactly what the condition means, to ring like a bell, it doesn't tell us how to say it. That brings us to the elephant in the room. Depending on who you ask, the word itself can sound very different. You've heard me say tinnitus, but I'm sure you've also heard it pronounced tinnitus. So which one is right? The debate. Clinicians and researchers often prefer tinnitus, while patients and the general public often say tinnitus. It's thought that many people say tinnitus because it sounds like a common inflammatory condition. Think bronchitis or arthritis. However, medical professionals point out that tinnitus is not inflammation, so the itis sound is technically a misnomer. But not to worry. Major authorities like the American Tinnitus Association and Merriam-Webster state that both are acceptable. So, what is tinnitus? Tinnitus is the phantom perception of sound and is often described in many ways, including ringing, hissing, buzzing, humming, grinding, whistling, whooshing, chirping, and even roaring. Tinnitus is a sound you hear without an external source. It can be in one ear, it could be in both ears. Sometimes patients report they can hear the sound in the middle of their head. Tinnitus is not a disease, it's a symptom, and the right evaluation points to the proper treatment. Now, we just discovered a lot of ways to describe the perception of sound with tinnitus. For those of you who have joined to learn more, or perhaps you have a loved one suffering with these symptoms, I'm going to play a few examples to give you a better idea of what those with tinnitus hear. This sound clip is compliments of our friends at NHS 24 in Scotland. It's about a minute long and it's going to give you an idea of the different sounds someone with tinnitus may hear. I want to give you a note. Some of these sounds may be loud and frankly, they can be a little annoying to hear. So I want to make sure you have a moment to adjust your speakers if necessary. Here we go. The symptoms people experience can vary in many ways, including the intensity of the sound, the pitch, even the occurrence, meaning that symptoms can come and go, or they can stick around and be persistent. Now, just imagine having these sounds playing in your head. The impact of tinnitus can be profoundly distressing, whether the phantom sound manifests as temporary and intermittent or constant and persistent. Tinnitus can interfere with auditory focus, concentration, the enjoyment of daily activities and hobbies, and even sleep. Friends, I'm so glad that you're investigating your tinnitus because more than anything, I want you to know You are not alone on your journey. Why do I say this? Let's explore a couple of facts together. Fact number one, approximately 10 to 15% of US adults report having some form of tinnitus. That's roughly 50 million Americans. And of these, approximately 20% report tinnitus is somewhat or severely debilitating. Fact number two, tinnitus is often linked to hearing loss. While tinnitus affects many people, you may not know that in more than 80% of the cases of the persistent tinnitus, some degree of hearing loss is uncovered. That's why it's so important to get a yearly hearing test. But what's the link? How are the two connected? Let's take a peek at what's going on. Take a look at this illustration. The tinnitus that you hear is usually the result of some problem along the auditory pathway, and the most common source is damage to the hair cells in your cochlea, or another way to think about it is your hearing organ. Typically, when there's more hearing loss, there's more damage. When the hair cells are damaged, they can spontaneously activate without any external sound source present. The hair cells are searching for stimulation, like when they were healthy cells, thus causing the phantom ringing we perceive as tinnitus. Many patients report the pitch of their tinnitus in the region where they have the greatest hearing loss. Now, that's a lot to take in and a lot to absorb, especially in a webinar style environment. So I want to take a minute and explain it a different way. Inside your ear, there's a part that's shaped like a snail, you can see on the illustration, and it's called the cochlea. Inside the cochlea, there are thousands of tiny hair cells. When sound comes in, these hair cells dance and send a message to your brain saying, "Hey, I hear sound." Sometimes these tiny hair cells get damaged, usually because a sound was too loud or because someone's getting older. This is what we call hearing loss. Usually, the more damaged the hair cells are, the harder it is to hear. When a hair cell is damaged, it gets confused. It starts dancing and sending messages to the brain, even when the room is totally quiet. It's like the hair cell is searching for the sounds it used to hear. Because the brain still gets a message, it thinks it hears a sound. But since there's no real noise outside, we call it a phantom or tinnitus sound. Fact number three, tinnitus isn't isolated to age-related hearing loss. While tinnitus is most frequently a byproduct of age-related hearing loss, the underlying mechanism, damage to the delicate hair cells in the inner ear, isn't exclusive to the elderly. Younger ages experience tinnitus too. In fact, for younger generations, this damage is increasingly self-inflicted through noise-induced tinnitus, often stemming from high-volume concerts, headphones, and loud work environments. Let's talk about some other causes for tinnitus. Now, we know that in more than 80% of cases of persistent tinnitus, some degree of hearing loss is uncovered. However, with intermittent or temporary tinnitus symptoms, they can stem from some pretty interesting reasons. Here are a few: ear infections, earwax impactions, extreme or recurrent exposures to loud noise, migraine headaches, head or neck injuries, sleep apnea, TMJ disorders, diabetes, certain medications you may be taking, anemia, hypertension, specific types of tumors, and conditions affecting the nervous system, such as generalized anxiety disorder or post-traumatic stress disorder. This is certainly not an extensive list of other causes, so it's important to connect with your audiologist about your specific symptoms and specific situation. Fact number four, Tinnitus symptoms can fluctuate or become worse. Let's see why this is. Increased perception of tinnitus is often associated with greater disruption in the hearing system or unhelpful activation of the fight or flight and emotional regulation systems. Tinnitus may seem more pronounced if you're less sensitive or unaware of the softer sounds in your surrounding. Most common factors that can cause tinnitus fluctuations include elevated stress, sleep deprivation or fatigue, and an excessive intake of caffeine, nicotine, alcohol, and sodium. Now, just like the last slide, that's a lot to digest. Let me say it another way. Sometimes the ringing in your ears or the tinnitus sounds are louder than usual, and it usually happens for a few reasons. First, the part of your ear that hears sound is having a hard time, so the ringing tries to take over. Also, your brain has a built-in alarm system called fight or flight. It's the same feeling you get when you're scared or upset. When this alarm goes off, your brain starts listening super closely to everything, which makes the ringing sound much louder. If you are in a place that's very quiet, or if your ears aren't picking up soft sounds, things like a cat purring or a fan humming, the ringing seems louder because it doesn't have any other sounds to compete with. Remember, when these ringing sounds seem worse, it may be related to things like feeling stressed, being tired, or excessive intake of caffeine, nicotine, alcohol, and even sodium. We've talked about a couple of facts. Let's talk about a couple of myths related to tinnitus. Myth number one, it's all in your imagination. Friends, tinnitus is not just in your imagination playing tricks on you. The sounds heard are very, very real, and they have very, very real consequences. Tinnitus is most certainly not in your imagination, and we can mark that as a myth. Myth number two, and this one breaks my heart when someone says it to me. There is nothing you can do about your tinnitus. While it's true there is no cure for tinnitus, that doesn't mean there's nothing you can do. There is hope. And if you stick around, we'll talk about some of those treatments. Remember, tinnitus is a symptom, not a disease, and symptoms can be managed. So telling someone there's nothing they can do about their tinnitus, well, friends, that's a myth. Now, before we get into how tinnitus is diagnosed and treatment options, I wanted to share a very quick history on tinnitus so you can see exactly how far we've come. I found it really fascinating, and I hope you will too. Humans have been experiencing tinnitus for thousands of years, long before modern audiology and long before we understood the brain. We have historical documentation of people trying to make sense of the mysterious noises that they're hearing. So, what did ancient civilizations think it was? And how did they try to treat it? The earliest documentation of tinnitus dates back to Mesopotamia. They documented the rituals and chants, and they would sing and perform these chants rituals to get rid of the singing in the ears. One of the chants read, "It has flown against me, it has attacked me. Oh, seven heavens, seven earths, seven winds, seven fires, by heaven be ye exorcised." There's no evidence the incantations ever worked. Next is ancient Egypt. They described tinnitus as bewitched ears and would treat with oil, tree sap, and frankincense. Ancient China. They viewed tinnitus as being related to a liver imbalance, circulatory issues, and kidney energy. They used treatments such as acupuncture, breathing practices, and changing your diet. Ancient China marked a step in the right direction about tinnitus because they understood tinnitus may be an indication of other conditions, and chronic gradual tinnitus was often tied to aging. Continuing our quick historical look, Tinnitus was also documented in ancient Greece. The Greeks believed tinnitus was caused by excess wind or trapped air in the head trauma, or an imbalance of the four humors. Their treatment techniques included regular sleep, bloodletting, and putting warm olive oil drops in tinnitus sufferers' ears. Ancient Rome thought tinnitus was the result of blockages in the ear canal, nerve irritation, trauma, and aging. They treated tinnitus with ear irrigations, cupping, bloodletting, and fumigation, with herbal smoke being directed toward the affected ear. Now, the last one I wanted to cover is from the Middle Ages. It said the treatment included heating up a loaf of bread, dividing it into two sections, and holding it against your ears until you began to sweat. They believed this would allow the sound to escape. There were many other treatments offered throughout the ages, ranging from exercising to holding your breath and even putting radishes in your ears. Luckily and very happily, medical diagnosis and treatment for tinnitus has come a long way. So we had a quick history of tinnitus, but in modern days, how is tinnitus diagnosed? Remember, tinnitus is primarily a symptom. The main objective of a tinnitus evaluation is to identify and diagnose its underlying cause. Here's how your journey will begin. You'll sit down with a doctor of audiology, someone who specializes in tinnitus. We'll walk you through what you hear, be it ringing, hissing, whooshing, pulsing, and when it shows up. We use brief tools such as the THI and the TFI to measure impact. THI stands for Tinnitus Handicap Inventory, which is a questionnaire used to assess the impact of tinnitus on a person's daily life. TFI stands for Tinnitus Functional Index, and it evaluates the functional impact of tinnitus symptoms. Both questionnaires are commonly used in clinical settings to help assess tinnitus severity and its effects on various aspects of life. These scores help us track progress over time, not just how it felt today. We review noise exposure, ear and sinus issues, headaches or TMJ, sleep, stress, medications. Small details matter. A quick change in a prescription, a new workout class, a recent cold. Any of these can nudge tinnitus. We test hearing across pitches and volumes to see what's missing and where. If hearing loss is present, we explain how it relates to your tinnitus. Clear hearing reduces listening effort. Less effort often means less awareness of tinnitus. We may match pitch and loudness, find your minimum masking level, and check residual inhibition. That tells us how your brain responds to sound and which therapies are most likely to help. That is so important because two patients can report the same ringing, yet need vastly different tools. And these measures help sort that out. It's crucial during your exam to express all of your concerns about tinnitus openly and accurately, providing a thorough medical history to avoid potential misdiagnosis or delays in diagnosis. Providing a description of the type of sound you're hearing can also help your doctor identify possible underlying causes. For example, clicking. This type of sound may suggest that muscle contractions in and around your ear could be the cause of your tinnitus. Pulsing, rushing, or humming. These sounds may indicate that your tinnitus stems from blood vessel or vascular causes, such as high blood pressure, and you may notice them when you exercise or change positions, like laying down or standing up. Low-pitched ringing. This type of sound may point to ear canal blockages, Meniere's disease, or stiff inner ear bones. High-pitched ringing. This is the most commonly heard tinnitus sound. This may be caused by loud noise exposure, hearing loss, or taking certain medications. It's important to note that these examples are just that, examples. That's why scheduling a diagnostic hearing evaluation is strongly recommended to assess if hearing loss could be underlying your tinnitus. Following this evaluation, your audiologist may suggest additional audiological tests or refer you to another healthcare professional who can help complete the diagnostic picture and provide inputs that bring you steps closer to experiencing relief. After your exam, your audiologist will have your audiogram, and it looks something like this. An audiogram is a visual chart that shows us how well you hear different sounds. It measures your hearing ability across various frequencies and loudness levels. We call those pitches and decibels. So we have an idea of how tinnitus is diagnosed, but how exactly is it treated? Before we move forward, let's remember the goal is not to erase the sound. Instead, it's to help your brain stop reacting to it. Think of it this way. We're shifting the focus from cure to management or control, moving the sound from your conscious all the time to your subconscious. Many people learn ways to make tinnitus softer, less noticeable, and less stressful. And education is often the first step. It's important to remember there is no one size fits all solution when it comes to tinnitus. The most effective approach to treating tinnitus involves understanding and addressing its underlying cause. Now, let's explore a couple of ways audiologists do treat tinnitus today. First, hearing aids. Knowing this, if your tinnitus is associated with some degree of hearing loss, it's important to address the hearing loss first. Treatment is most commonly accomplished with hearing aid assisted devices or hearing aids. These devices restore access to soft sounds you were missing, thereby enhancing quality of life while providing essential stimulation of the auditory nerve that helps reduce your awareness of tinnitus and redirecting your brain's focus from the tinnitus to environmental or therapeutic sounds. Many hearing aid models include tinnitus sound generators, masking, app controls, and direct streaming for phone and TV. Less listening effort often means less tinnitus awareness. Linear. As an overview, this treatment pairs tailored sound from the headphones with gentle tongue tip pulses on the tongue. Together, they help your brain pay less attention to tinnitus over time. Treatment sessions are simple, repeatable, and guided by a plan determined by your audiologist. It's important to note a few things about Linear. Linear is a prescription-only medical device available exclusively through a rigorously vetted network of certified tinnitus experts. Providers must undergo extensive in-person training and complete specialized coursework. Linear is the first of its kind to receive FDA authorization for tinnitus treatment, supported by large-scale clinical research and real-world evidence. In clinical studies designed to meet FDA requirements, a high percentage of participants reported meaningful benefit, and they would recommend Linear. Widex Zen Therapy. It combines the right elements from four components: relaxation and stress reduction strategies that support habituation, counseling and education to de-threaten the sound, amplification when hearing loss is present, and Zen fractal tones and other sound therapy tools. That fractal technology is based on a mathematical algorithm and ensures that there are no sudden changes in tonality or tempo. The tones repeat enough to sound familiar and follow appropriate rules, but vary enough not to be predictable. This means that they are not associated with music, which you might memorize and therefore become immune to its relaxation and tinnitus masking efforts. Now, the three examples we reviewed have had amazing success at helping those suffering from tinnitus. However, the list of treatments does not end there. Sound machines and sound enrichment. Simple tools can help, especially at night. White noise machines, fans, or app based soundscapes reduce the contrast between silence and tinnitus, so your brain isn't fixating on the sound. Many patients use bedside streamers or speakers to help them fall asleep. Our team of experts can recommend options that fit your routine. Some sound therapy apps include My Noise, Resound Tinnitus Relief, and Widex Zen. Tinnitus retraining therapy. Tinnitus retraining therapy or habituation based care have similar approaches that combine education, sound therapy, and consistent follow up. The aim isn't to erase the sound, it's to change how your brain responds to it so it becomes neutral and easier to ignore. Progress builds over weeks and months with steady use. Cognitive behavioral strategies counseling. Cognitive behavioral strategies can lower distress, reduce the fight or flight loop, and improve sleep. Some patients benefit from brief, targeted counseling alongside sound therapy. Sleep and daily life strategies. Better sleep lowers the tinnitus burden. Patients have tailored bedtime sound enrichment, simple relaxation routines, and room environment tips for your space. Daytime strategies matter too. Strategic seating, visual cues, and communication techniques that reduce listening effort in meetings, restaurants, and family gatherings. We've talked about what can be done. Now let's talk about who can help you do it. Navigating tinnitus requires more than just technology. It requires a trusted team of experts who specialize in these exact solutions every single day. Meet our team of experts. At Northwest Hearing and Tinnitus, we are passionate about your hearing health. We don't just treat hearing, tinnitus is a core part of what we do. It's in our name. Experience is the foundation of trust, and for over 30 years, our team of experts have been the cornerstone of hearing health for the Puget Sound community. When dealing with something as deeply personal and complex as tinnitus, that 3-decade legacy matters. It means we haven't just seen the evolution of treatment, we've mastered it. Now, we don't rely on history alone. Our audiologists hold a prestigious certificate in tinnitus management from the American Board of Audiology. It is vital to understand that this is a voluntary, advanced specialization, a choice our doctors make to go far beyond standard practice. This certification represents an elite level of dedication, signaling that you aren't just seeing an audiologist, you're seeing a specialist who has proactively sought out the highest level of training available today. It's that commitment to excellence that allows us to offer exclusive prescription only solutions like Lanier, ensuring you receive the care that is as specialized as it is compassionate. And why does this matter? First of all, you work with a doctor of audiology who listens first and builds a specific, personally tailored treatment plan. Next, you've got real choice. Northwest Hearing and Tinnitus carries lots of top tech options from partners like Oticon, Widex, Signia, Resound, Phonak, and Starkey. We do this so the device fits you, not what we carry in our inventory. Hand in hand with this is straight pricing, no games. We check benefits, explain costs, and lay out options clearly. We are also proud to make tech easy. Charging, cleaning, Bluetooth, apps, TV streamers, we set that up and we show you how it's done, step by step. And support that sticks. Routine check-ins, quick adjustments, cleanings, and help whenever you need us. And most importantly, Northwest Hearing and Tinnitus is close to home. Consistent care across Seattle, Bremerton, Olympia, and Gig Harbor. With clinics conveniently located throughout the area, expert care is never far away. And if you're ready to take that step to tinnitus relief, today is the day you can start your journey. If you're interested in learning more, we'd love the opportunity to connect with you. Here's our contact information. I'm so grateful for you for hanging around, spending part of your day with us, and learning more about tinnitus. Wishing you a fantastic rest of your week. Thank you so much, and we hope to hear from you soon.